Clinicians, Stacy Stratz and Hannah Rains, here to present to you today. Welcome, ladies.
So again, if you're just coming on, we welcome any questions that you have. This is very informal. If you have questions as we are talking about a specific thing, let us know. We will have some information that we can share with you if you want to contact us. That's not going to be in this presentation, but we're going to talk about it that is more specific, that if we talked about everything, it would be a much longer webinar. But we will try to fit in as much information as possible to let you know kind of what we're about. Our program is called Children with Chronic Health Conditions, Title V, Children with Special Health Care Needs, and the title is How Our Program May Be Able to Help You and Your Child. Oh, yes, okay. And that is our building downtown Little Rock. And we are under the Division of Developmental Disability Services. And we were formerly called Children's Medical Services. If y'all remember that. Hannah Rains is also with us today. She covers several counties. She actually has one of the larger caseloads in the state right now. And she's based out of Poinsett County. I'm based out of the Jonesboro office. And we're going to talk about the key points today are what is our program? What are the goals of our Children with Chronic Health Conditions program? Who do we serve? Who can refer to the Children with Chronic Health Conditions program? And how can you refer to the Children with Chronic Health Conditions program? And we're going to talk about our access to care and outreach. The Maternal Child Health Bureau defines children with special health care needs as children who have or are at elevated risk for a chronic physical, developmental, behavioral, or emotional condition that requires health and related services at a level beyond that which is required for a typical child. The Title V program for children with special health care needs is housed in the Department of Human Services, Division of Developmental Disability Services. And we did change our name to Children with Chronic Health Conditions in 2018. And I apologize, I'm going to silence my phone. Federal funding for children with special health care needs is through the Title V Maternal and Child Health Block Grant. And like I told you before, we were formerly known as Children's Medical Services, and we were also formerly known as DDS Children's Services. The Arkansas Department of Health gets 2/3 of the Maternal Child Health Block the Maternal Child Health Block grant funding, and we receive 1/3 of the funding. Our Children with Chronic Health Conditions mission statement is to ensure that children and youth with special health care needs in Arkansas receive the services and support necessary to achieve their greatest potential. Children with chronic health conditions will work together with families and providers to assist in addressing their concerns related to children with special health care needs by promoting assessment, intervention, education, and coordination of services. And I promise I'm not going to read all these to you verbatim. We're going to get into some examples, and hopefully you'll find it more interesting and informative.
Stacy, I'm sorry to interrupt. Are you moving? Are you changing the slides?
I am.
Oh, because and it might just be me, but I'm still stuck on the picture of the Little Rock office.
Oh, you are? Okay. I'm sorry. Okay. Hang on a minute. Okay. So what about now? Still the Little Rock office?
For me, it is. I see you moving over here.
What about Katie? What about in the chat box? What's everybody else saying?
Okay. Yes, it's still there, George Oliver said.
Okay, hang on a minute.
Sometimes it takes a minute to catch up, or you have to stop a screen share and restart
And I
it.
apologize, y'all. I'm so used to doing these in person that it's taken some get used to doing this virtually. I can do slideshow. Let's do it that way. Let's do slideshow. We'll start from the beginning, but then I will just
It looks like the screen is frozen because your mouse is still not moving.
Okay, what about now? Because it's
No.
moving for me.
No, it's not.
Okay.
Sorry.
Katie, what do you suggest?
I say stop your screen share, and
Okay.
then you can hit screen share again, and we can keep on going.
And hit screen share again?
Yes, that usually works.
Okay.
And no need to apologize. Technical issues are commonplace.
Okay, what are y'all seeing now?
Says you have started screen sharing, but it hasn't come up just yet.
Okay, there
Now
it
I
is.
see your slides.
Yep.
You see it now? Okay, sorry guys. Okay.
You're
So
perfect.
I've defined that. Okay, I've explained that in the mission statement. And so children with chronic health conditions, our primary goals are to assist families in accessing community-based care services for their child with special health care needs. And we also, our goal is to assist families with transition from pediatric to adult systems of health care. Our children and youth under the age of 21 years of age residing at home in a non-institutional setting in the state of Arkansas can possibly receive our services who have a chronic physical, developmental, behavioral, or emotional condition that requires health and related services at a level beyond that which is required for a typical child. They normally need to be Medicaid eligible for our case management program, that which is SSI Medicaid, TEFRA, and our Kids A. They have to meet eligibility criteria and not currently be receiving case management services through another program. And they cannot be enrolled into a PASS, which would include a behavioral PASS or a DDS PASS. With the exception of case management services, we do have a sister partner with Early Intervention First Connections that do case management, and we can provide case management if a child is receiving Early Intervention First Connection services. Our CHC nurse case managers provide care coordination to families of eligible children who do not have case management services available to them through other channels. Care coordination connects families with community and state resources to serve their needs. This support is in line with the national objective of providing family-centered, community-based, coordinated care to children with special health care needs. I also want to discuss briefly, and I think we talk about it further down the line, that we also have a non-Medicaid program that we have across the state that is for our children that they either have insurance or they may not have any insurance. They may be an undocumented child that does not have insurance, or they may have our Kids B, which doesn't give them full Medicaid benefits, that they may qualify for other services that their our Kids B or their insurance doesn't cover. Like for our Kids B, our Kids B does not cover hearing aids. It does not cover insulin pumps, orthotics. So we have a non-Medicaid program, and our non-Medicaid nurse is Shelley Barnes in the Randolph County office. And I supervise her, and we cover the whole state for that program. And so also families that do have insurance, but they need help with and they meet the financial and medical criteria to fill in gaps, we can assist, and we're going to go into those categories in a little bit, but we can help with co-insurance and meeting deductibles for their medical appointments, hospitalizations, and medical equipment and things of that nature through our Title V grant funding programs. So we do have case management, case coordination with our Medicaid children, but we also can assist our families that do not have Medicaid, that may have insurance, or they have our Kids B that does not cover things that a regular Medicaid or their insurance may cover. That could be, we also have insulin pumps, continuous glucose monitors. We help pay for hearing services, hearing aids, vehicle lifts, and I think that Hannah will be going into that a little bit more detail later in this webinar. Our pediatric registered nurses serve as facilitators, educators, advocates, collaborators, and counselors to provide parent education by explaining how to apply for programs such as WIC, which is Women, Infant, and Children, Medicaid, such as SSI and TEFRA, and benefits of these programs to their family. We also provide parents with the information, skills, and tools to advocate for the medical needs of their child. We link families to local, state, and national resources. We also assist the families to access community-based services and supports. Some things that we can help with, and we will, I've already talked to Katie about this, but we will make sure that it gets on their information site. And then if y'all want to contact us, we can also provide this to you. But we have, we do a lot of referrals to the RHIP program. And the RHIP program is very helpful for especially our families that are on TEFRA and they have private insurance and they struggle to pay that TEFRA premium. If they have to be on an employee-sponsored insurance, and if they are on an employer-sponsored insurance and they have Medicaid and they're not self-employed, and the program deems it cost effective, then they can possibly reimburse everybody on that family, the whole entire family that's on that insurance premium for their premium each month, which frees up the ability to pay the TEFRA premium. They have to see that the cost of paying that insurance premium for that family is going to be beneficial. So the cost of the care for that child is going to have to exceed what the cost of the insurance reimbursement for the family would be. And that's how they determine the cost effectiveness. It's about a 2-page application. There's a website to go to. We can get that application and we can help the families with that. It does take a little time to get an answer back on that. And if you don't get an answer very timely, we always encourage the family to call them back. Sometimes they require more medical documentation from the primary care physician and specialist to justify that it's cost effective to reimburse that money each month. But it has helped a lot of our families. It is very popular. Rodney will not mind me saying this. Rodney is the leader of our Parent Advisory Council, and he has an adult son that has spina bifida, and he's in his 30s, and he is still able to get the RHIP reimbursement because his son is still on his insurance. And that's another thing to let y'all know, in case you don't know that, is that sometimes on the fine print on the insurance doesn't let you know that if your child has a disability. And I'm not going to say this happens every time, but always look at the fine print, because when your child has a disability, sometimes more than not, they can extend on that insurance past the age of 26. And so like that's what the case is with like Rodney. And so then with him being able to he still receives Medicaid and he's on private insurance, he is reimbursed every month for that RHIP. And so that's a great benefit to help them. But a lot of families don't know that they can still try to get insurance if their child has a disability after the age of 26, because the insurance companies sometimes don't like for people to know that, and they put it in very fine print. RHIP, and then we also and we're gonna share this with Shelby and Katie, but we also, if in the regions that Southeast Trans provides non-emergency Medicaid transportation, they will, and they're the only provider as of today that will do this. And I actually learned this from a parent, that they will reimburse the parent at 52 cents a mile if you're in the Southeast Trans regional area. So like, for example, Craighead County, Randolph County, in our northeast and northwest areas of the state, Southeast Trans is the provider. And I will provide a map to Centers for Exceptional Families so that they will have that. So, and I can also share that with anybody that wants to call us. Unfortunately, down south, they don't have that. They're not the transportation provider, but we finally have received written instructions on how the parent can be reimbursed. They also have a standing order form. So if the child goes to therapy 2 or more times a week, there's a standing order form where you do not have to call every time, because they would like for you to call two days in advance. And what you have to do is you have to have the name of the provider, their phone number, the address of where you're going, and then they give you an authorization number. And then there's a form that the provider has to fill out verifying that the parent was there, or whoever's doing the transportation. And then the person doing the transporting has to sign it, and then they have to send that in. There's also a direct deposit form. And I encourage anybody that a parent or guardian that wants to be reimbursed to do the direct deposit, because you get your money much faster. So there are very good directions on there. We didn't have those before. The last time I did a presentation for Shelby, I kind of had my own little directions on there, but now we have written directions. But the unfortunate thing, it's only for the areas that Southeast Trans is the transportation broker that reimbursed for the family, or for the parent to be reimbursed. But especially with our families, some of them are have to quit work because there's so many appointments and everything. It does help, but they do have to call in advance, and there is a process to it. It is a little bit tedious, but it does help, especially if you're having to go to Children's Hospital in Little Rock or different places several times. It is very helpful to help with financial in that aspect. Let's go to the next one, and we can get y'all that information if you want to call us, and we'll also share it with Shelby and Katie. We also assist families in applying for other funding sources such as Medicaid, Women and Infant Children, SNAP, which is Supplemental Nutrition Assistance Program, that used to be called food stamps. We also provide written assessment of child's needs, including an analysis of recommendation from medical reports. We work with family to develop a service plan for access to care, and we monitor child's progress. We had an area manager that we also do a growth chart, and we do plotting of their height and their weight. And we had an area manager that was taking over some cases when we had a vacancy, and the height and the weight was going significantly down. And it kind of alerted her, and she contacted the primary care physician's office and was just kind of letting them know, that her concern with that. And they had the physician's office hadn't noticed that, and come to find out, they did some more testing and looking into it, and the child had cancer. And it was our area manager that helped kind of point that in the direction, this is kind of a concern. And not that we're trying to be the doctor or anything, because we're not, but it just helps to try to see that, hey, there's a pattern here, something's going on. So that helped that child in that case. Children with chronic health conditions case management includes all activities to assist families in gaining access to community-based services appropriate to the needs of their child with special health care needs. And our targeted case management is a Medicaid billable service that coordinates services to assist families of eligible children and youth in accessing all medical, social, educational, and other services appropriate to the individual's needs. But with that being said, that money that's billed to targeted case management when we do assist those families goes directly back into direct services for those families. And Hannah is going to go into detail in what some of those direct services are that we might be able to help provide to you or to your family. But that money goes directly back in to try to help those families. Oh, I'm sorry.
All right. Hey, everyone. I'm Hannah Raines. I am the nurse care coordinator housed out of Poinsett County, but I cover about 13 different counties. So just because I'm housed in Poinsett doesn't mean I just have Poinsett. I go up as far west as Lone Oak, and then all the way to the Mississippi River and all around. So some more information on kind of what we as care coordinators can do. Provide outreach to local PCPs and pediatric specialists to inform them of ways that CHC nurses can help with children with special health care needs in their practices. We connect a lot of parents to the James L. Dennis Developmental Center, also known as the DDC, and the Arkansas Children's Rehabilitation Outreach Clinics that Dr. Steffens usually travels around the state to. We actually, before all the COVID happened, me and coworkers across the state, we would actually go and help at some of these clinics. And that way we could actually, while the parent was there, we could actually see them, see the child, gather more information, and kind of get a jump start on what they need. And it also helped because if there was something in need, the doctor's right there as well. So we could kind of get a head start instead of having to contact doctors later and contact parents later. Hopefully we'll get to do that again someday. So CHC nurses participate in local clinics as a resource person for pediatric development and rehabilitation physicians. We also help with the community-based autism liaison and treatment network teams, also known as COBALT. I know Charlotte, and I know a lot of other nurses as well, actually help with work closely with those COBALT clinics, and will actually contact the parent prior to the appointments to get paperwork done for that doctor before their appointment. So it was an issue before where some parents would come with paperwork not done or completed, and they were in the waiting room trying to hurry up and get it done. I know personally it takes anywhere between an hour to 2 hours to get that paperwork done just over the phone or in person with a parent. So I can't imagine a parent having to sit there in the waiting room trying to get that done. But it helped the doctors go ahead and be able to review it beforehand and kind of know a little bit of what's going on. So that's just one way we can help with that. Stacey, we go to the next slide, please. Okay, we also help with finding a medical home, such as if parents are wanting to switch PCPs, we can actually try to help find someone maybe closer or just someone different for them to try. Finding information about your child's condition, kind of just more information, even if it's, finding some information from websites and even from the doctor if they have any recommendations to give parents on educational tools. Finding support in times of stress or crisis. So that could include respite, which we'll discuss in a little bit. Obtaining medical equipment related to their child's special needs. Coordinating payment for their child's special health care needs, which we'll kind of go over a little bit in further detail in a minute. Working with all the professionals on a plan that meets their child's and their family's needs. And that includes, getting specialists, PCPs, therapists, kind of everyone on board with if something for the parent, and even other resources such as, the Center for Exceptional Families. Transitioning from the pediatric care system to an adult care system. We focus a lot on transition later in the teenage years. Applying for insurance for their child as he or she transitions to adulthood. Next, please. Okay. So when funding allows, CHC provides limited direct services to fill an unmet need when no other program, service, or pay source exists in Arkansas to provide these services to families of eligible children. Services for CHC eligible children are prior authorized by CHC. The CHC program is the payer of last resort, meaning that if funds cannot be found, meaning that CHC funds cannot be used to pay for services covered by other programs or pay sources. So if it's something Medicaid covers, we cannot step in and pay for it. Would definitely have to go through Medicaid and other avenues first. If a child would be eligible for Medicaid or for insurance through the Affordable Care Act, the family must apply for coverage before they can be eligible for CHC services. Something else I meant to kind of explain a while ago, I'm sorry. So like for as a payer of last resort, so, we definitely try to see if Medicaid can pay first. And then we can actually try to go through the Well Child EPSDT to see if that is possible coverage. I mean, it may not be, but it is something we try to do because sometimes it will. And then some other resources, just an example that I sometimes reach out to the United Cerebral Palsy Foundation. They don't help just children with CP, they help children with all diagnoses. And they've actually covered the one in Little Rock and the one in Northeast Arkansas has covered a lot of equipment and respite funds and all kinds of stuff for my families. And then of course, then we can pay for it as a, like I said, as a last resort. Okay, next slide, please.
I just wanted to say one more thing, Hannah. On the EPSDT Well Child, they encourage us. There's some things that Medicaid doesn't pay for. And, you know, for the longest time, Medicaid did not pay for ABA therapy. And it was recommended through the EPSDT Well Child exam. And it was recommended, I think, so often that they finally made that to where it is something that Medicaid will pay for with the proper referrals now.
Mhm.
So even though it's something that Medicaid will not pay for, we do try to push it through if the primary care physician recommends it through the EPSDT Well Child, sometimes Medicaid is paying for things that they normally would not pay. But if that goes through there and it does not pay for it and they meet the medical and financial eligibility, then that is a possibility after that process that we might be able to assist in paying for something.
And Stacey, just to add from what you said, I'd recently, tried to help a family get an adaptive stroller, and that is something definitely Medicaid doesn't pay for. But I was told or advised to go through the EPSCT, and when we're talking with a specialist from LeBonner, they kind of said the same thing, that is something that they don't pay for, but hopefully because they do get a lot of requests from that hopefully Medicaid will eventually start paying for adaptive strollers for children. So, but that is something I learned not too long ago. So,
and we also try to refer to the ICANN program in Little Rock when we can, but that's not to say that we're not going to try to help people, but we also try to use that as a resource as well.
Stacey, you want to cover the non-Medicaid
Yes.
part first?
So on our non-Medicaid population that I talked to y'all about before, that's Shelley Barnes out of Randolph that covers the state, and myself. For our assistance we do have assistance categories. There for a while we ran out of money and didn't have any money, but so we had to kind of streamline things and reorganize and regroup. So we had this promulgated, and we now have deductibles and co-insurance. So for our people that may not have Medicaid, but they have insurance, if they meet financial and medical for anything from diabetes to asthma to, it can be scoliosis, it can be a vast array of medical diagnoses. We can assist with the deductibles to help them meet their deductibles and or their co-insurance amount up to 1 month of their household gross monthly income as determined by I can't see what that says there, but as determined by our staff during our eligibility determination, and provided that it does not exceed the assistance limit for deductibles and co-insurance. So that helps them meet their deductible. So then whenever their deductible is met, then that should be covered at 100%. And that's for the period of eligibility, and our application is good for 1 year. So if they have a continued issue, then they would just reapply, and then we would start over again and start helping cover that again. So you want to get the next one?
Yeah. So the next few slides are talking about what we can do for both Medicaid and non.
It froze. Hang on. Something happened to Hannah. Did we lose everybody else?
No, I think it's just Hannah. Probably
Okay.
keep going. I bet she will come back in.
Okay. Well, I can go ahead so that I'm staying on the time frame. Both Medicaid and non-Medicaid populations can be covered under the adaptive equipment. We have a lot of adaptive equipment that Medicaid does not cover and insurance does not cover. So that includes any assistive technology device, equipment, or product system used to increase, maintain, or improve the performance of activities of daily living for an eligible child. Adaptive equipment may be purchased off the shelf, modified, or custom made. And some examples include wheelchairs, communication devices, portable wheelchair ramps, and sensory items. On the communication devices, if the school recommends it, the school would be responsible for paying for it. If it's part of their IEP. But there's a lot of things, like I said, that Medicaid does not cover. Vehicle lifts are very expensive. That's something else that we look at. So just, you can always call us and we can see what we can do. And even if we can't pay for it, then we can see if there's another resource out there. I hated that she got knocked off. We also, prior to COVID, we did help pay for medical camps for both Medicaid and non-Medicaid populations. And they average about $650 for the week. And except with the exception of like spina bifida camp that was free to campers, this was something great that was very helpful to our families. The camps were specifically designed to meet a child's specific medical and or developmental needs while providing opportunities for children with medical needs or developmental delays to increase independence and learn from social interactions with peers. Some of the camps included diabetic camp, hematology oncology, Camp Aldersgate, asthma camp, Camp Barnabas, and We Care Foundation. I helped with a muscle walk and did an information booth at the muscular dystrophy muscle walk 2 Octobers ago. And I had a family tell me that they went, and I know we didn't help pay for this camp, but it was just to give you some perspective on these camps. Sorry, I may get emotional. This family said that they drove all the way from Northwest Arkansas, and their son had recently been diagnosed with, and I may not be saying this right, Duchenne's muscular dystrophy. And he was very depressed, and he was not hardly doing anything for himself. And they decided they were going to drive and they were going to go to this camp. And he told them the whole way, I don't want to go, Mom and Dad, I don't want to go. Well, when he got there, they decided they were going to at least try to get there. And then if they had to turn around, they would turn around. Sorry, Hannah. I guess you got kicked out somehow. But anyway, he once he got in there and he saw these kids that were like him and they were going through what he was going through. They said it was the best. He'd been to therapy, and I was like, I've got a soft spot for these kids, so I'm sorry. But and they'd been to therapy and everything, and they said it was the best therapy that kid could ever have, because he went out of there, he had a different attitude, and just thrived after that. And that's what those kind of camps will do for these kids. And I know a lot of y'all probably already know that, but it's just a very neat story that I like to share. But anyway, Hannah, you can go ahead and do the next one, medically necessary item.
I'm sorry, my laptop decided it needed to update right in the middle of this. So, okay, medically necessary items. A medically necessary item or equipment prescribed by a PCP or other attending medical practitioner. Some examples include PKU foods, hearing aids, scoliosis braces, insulin pumps, and diabetic supplies. Parent education, we can also help provide for fees and necessary expenses associated with parent/guardian acquiring knowledge for their eligible child's CHC qualifying disability or delay. Some examples include condition-specific conference, registration fees, travel expense for parents, for like hotel, airfare, or meals, condition-specific classes or workshops, and educational materials for books, DVDs, etc. Our most recent one before COVID would have been the Family Bistro that we would have had. But that all went virtual, which was they were still able to attend. But we would help pay for that, their registration fee to come and everything.
And what's great about that, y'all, is that's something new that we used to not help pay for, that we help pay for now. And it's something that I think might be helpful is like for somebody that's needing to sign language, I think we might be able to help with something like that too, if they're needing to learn sign language and things like that. So I think it's a great thing that we've added that we did not have before.
Something else that we can help with is respite, which would be temporary relief that allows the primary caregiver of a child with a disability or special need to have an occasional break from caring for their child. Respite services must be provided by a Medicaid enrolled provider of respite, supportive living, or personal care services. So something that we do is we, of course, give choices to the parents of who they would like if that is something that they do want. We provide, services around that in that area, or especially someone that could be specialized in pediatrics. And so, but some parents don't know, some of these providers will actually kind of hire either a family member, friend to actually be a child's caregiver. But of course, it can't be just like mom or dad. It has to be maybe grandparent, aunt, uncle, cousin, someone on down the line in the family, or just a close family friend. But they'd be like an employee of a personal care agency and get paid to care for that child. Something that it's fairly new, and that they're actually offering, and a lot of families don't know that. So that might be something to ask if someone is interested in that kind of resource too.
So
Is there a
to kind of
question?
elaborate on that, we do have a question about that, Hannah. Is there an age limit for respite? They have to be under 18, and that's a good question because for our non-Medicaid kiddos, they also have to be under 18 to meet the co-insurance and deductibles, or to help pay for adaptive equipment or parent education. They have to be under 18. For our case management, they can be up to the age of 21 as long as they have not received a certificate of completion or finished high school. A thing about the respite is in the old days, we used to they have to meet functional limitation criteria, and they have to be on SSI or TEFRA and they have to be under a certain TEFRA premium. But before we would pay the parent, or we would give the money to the parent if they qualified, and then the parent would hire somebody and then give us a receipt. They don't allow us to do that anymore. And so it has to be paid directly to a provider. And we pay the provider, we give the provider $1,000, and we give them $250 in administrative fee costs, because they have to do the background checks and the other administrative fees. And so that $1,000 can be up to the parent or guardian and the provider for whether they want to do 40, however many hours at one time. Hannah recently had a situation, I think in Craighead County, where the mother was having rotator cuff surgery, and she was not going to be able, she was going through, I don't think she was a single parent, and she couldn't lift on the child. So we worked diligently to get it approved so that she could have some respite support, so that a person could come in and help her, so she would not be lifting on her child and adversely affect the surgery that she had.
And
So
the
we
parents
do,
come up with the schedule. I mean, this caregiver that they had, she would stay till 8 o'clock at night until the child went to bed, to put the child to bed, so it's really up to the schedule, and of course, the company, but it's, you work with the company works with the parent. So it's
and
really nice.
And the other question says, how many hours of respite care will the family receive? That depends on, I can't really give 100% answer because I'm not sure what the provider charges. I know at one time that the respite care was about $18 to $20 an hour, but I don't know if that's what the rate is right now. I can find out, Georgia, and let you know what that specific provider charged, that it was charging us for that. What they were doing was just charging us an amount. And they've used almost all of it because of her surgery. It's something else we did, but I can find out about how much that is about an hour. But I want to say it's probably around about $20 an
I think
hour.
that's right. I think I seen that on the receipts and stuff was about that rate.
And also, we have some children that need personal care, and we also can help coordinate getting personal care started as long as the child has Medicaid. And it is, they do have to go through, we have them pick the agency. We don't pick the agency. Optum has to do an assessment to determine the tier level of how many hours they would qualify for. But we can also help assist with getting personal care started if that child needs personal care.
Okay. Vehicle modifications. So modification in accordance with the ADA requirements that allow the vehicle to be accessible for an eligible child and increase the eligible child's mobility or access to services. And then some examples would include a wheelchair carrier or lift for a vehicle, or a ramp for a vehicle. So, we've helped quite a few of those, and, families don't know that that there are other options, because I mean that get expensive, and a lot of families don't know that that's something that we can help cover because Medicaid doesn't. So, but then of course any decision, CHC decision, a parent or recipient has the right to appeal it. To appeal the decision, you must make the request in writing to the CHC program director within 10 business days from the date of notification. Where can families apply for our Title V services? Hospitals, schools, Title V community-based offices. Families must apply annually with eligibility redetermination. Also, which we'll get in more detail with the website in a minute, but down at the bottom, humanservices.arkansas.gov is a website where all of our applications and more information about us is available on that website.
And we call our office community-based offices, but basically that's the DHS offices. But you can also, if y'all want to apply, we have a referral number we're going to give you, but you could also call Hannah or I, and we can get the referral process started. You call us at any time and we'll give you our contact information.
There are 12 CHC community-based offices, ones at the Berryville, Conway, Fort Smith, Harrisburg, Huntsville, Hope, Jonesboro, Neenah, Mountain View, Pocahontas, Prescott, and then of course Pulaski, and that's the Donahue Plaza South, the picture earlier. That's our main, our central office.
And there are pediatric registered nurse case managers in all of those offices listed. And I don't know why, but it wasn't wanting to give me the little thing here. Sorry.
Okay. And then of course, like I said, the number listed is our DDS intake and referral unit. But of course, if anyone all over the state, you could easily send an email to either Stacy or I, and then, if it's not a county that one of us, I cover, then we'll be glad to get it to the appropriate CHC nurse to kind of handle everything, to take over and just get the information to them. So once CHC receives a referral, the program will contact the family to answer questions about the program, learn about their child's and family's unique strengths and needs, and guide the family through the process to develop their individualized plan, which will assist the child with special needs to reach his or her maximum potential. So what I like to do, I just like to give examples. So when I get a referral, I contact the parents and kind of talk with them, see if they're interested. If they are, then what I try to do is fill out most of the application, especially if they have Medicaid. We can find that information on the Medicaid sites and be able to find most of like demographics. And then what I do is I either, if they give me their email address and have ability to print and scan back, I email it to them so I can get it back quicker, or I will mail it and include a return envelope so they don't have to pay for postage. And then once I get that back, I like to request medical records just to verify everything. And then once I get all those and get reviewed, I contact the parent and we kind of come up with a game plan, and I make sure I have all the information from the medical records correct. And then I kind of start asking them like, well, what's going on? Is there concerns or needs that you have? And then of course, if there's any information that I have, such as like, if there's Southeast Trans, if that's available, I tell them about it. Or if RHIP, if they have TEFRA and they don't know about it. I also like to ask if their child if they're potty trained, especially depending on what diagnosis they have, because some families do not know that Medicaid will pick up. Of course, with talking to your provider or the PCP, if incontinence is an issue, that Medicaid will start paying for diapers or pull-ups at the age of 3. And so if that's something that they don't know about and that is an issue, then I try to start contacting. I take over. I say, well, I'll contact the PCP. I'll get the prescription, hopefully that they'll give me a prescription, and then I'll turn it in for them, or if they send it to me, or if they can send it in themselves. So, and then another kind of resource that I talk about is, of course, I actually had a family that was seeing a specialist in like Boston, at Boston Children's Hospital, and they were going there for surgeries and yearly appointments. Something that they did not know is that Medicaid will actually cover airfare for one parent and a child. And so they were actually able to have to pay for the dad's airfare ticket, and they were all able to go and get that covered. But there's just some resources that are not known that we kind of do, and try to advertise those to these families that might be able to access those resources. So
another thing that I wanted to mention too, that we just got new applications on, is the Arkansas Autism Partnership. For our families that have a child that has a diagnosis of autism, if they apply for the Arkansas Autism Partnership waiver before the age of 5, they have to apply before the age of 5, but once they apply, they can continue services for a period of 3 years. But they can get the ABA therapy, the applied behavior analysis therapy. They can possibly pay for sensory items. But we have the new applications for that in Spanish and English, and I will get those to Shelby and to Katie. And if any of y'all are interested, Hannah, I know, and I think Charlotte has assisted definitely in helping complete that paperwork for the Arkansas Autism Partnership. It's a very great program. We also have assisted in the paperwork for the EPSDT ABA therapy and that could be eligible for children up to the age, I believe, of 21, because EPSDT, which stands for Early Periodic Screening and Diagnostic Treatment, goes up to the age of 21. We can also assist with getting that paperwork to the primary care physician to get that paperwork processed to try to help with that therapy. Sometimes the issue is, if they live in a very rural area, being able to find a therapist to do the therapy. But so the Autism Waiver Partnership is another thing that we assist with, the EPSDT ABA referral process. We also help a lot of families with the TEFRA referral process. A lot of families don't know that like she said, we do a lot of transition from pediatric to adult, and it's not really just healthcare, but it's also about insurance. And a lot of our families think that the insurance, that if they're on SSI, that they automatically get SSI and don't have to do anything, but they do have to reapply once when they're turning 18. We also, but then you also have families that make too much money right now, and then when the child gets 18, might be able to qualify for SSI, because they may not necessarily count the family's income once they turn 18. So there's a lot of different things we look at to try to help them. Another thing that I always don't want to forget that's kind of new is that when you have your children that are going to turn 19 and lose their TEFRA, there is a new category of Medicaid called frail Medicaid. And I know that sounds like it's a frail elderly person, but it's not. And it is through the Arkansas Works program, even though you don't have to be at the eligibility of being able to work. but it is the frail category of Medicaid. And so if you have a child that is, or a youth that is getting ready to be taken off of TEFRA, turning 19, then you definitely want to contact your DHS office and ask them about the frail category of Medicaid, because we have some families that are able to continue with their Medicaid for Medicaid for their child based on that category of Medicaid. That is something fairly new that a lot of people do not know about, that it's been very helpful, which also continues to have them be on Medicaid. And if they have their private insurance, helps maintain that, where they get they get both insurances and maintain where they get to stay on the RHIP program as well. I don't have a whole lot of information about the RHIP to just give you a brochure on, but from what I understand, from what the DHS, the Division of County Operations tells me, you don't have to like prove like you do like with TEFRA about the disability. So I guess if you've already had the TEFRA and you're going into that, I guess that's why you can just kind of transition into that frail Medicaid. But that's something that's an option, because that has been an issue in the past for our children that are going to be losing their TEFRA and they don't qualify for another category of Medicaid due to income. So there's other avenues like that that we can try to help them with transition to help try to maintain some type of insurance. So always keep that in mind as well. Hannah?
And this is just our kind of directory of who covers what counties. No, it's quite a lot of information to paint all at once, but this will be available, especially on the next slide. It gives our full website to where you can see who covers what counties. Or I'm sorry, not the next slide, but the next. The Parent Advisory Council is a voice for all families of children with special health care needs in the state. So PAC formed 30 years ago with statewide parent volunteers. It is one of the oldest and strongest PACs in the U.S. PAC meets 4 times per year to offer guidance, assistance, and to monitor program policies and direction. So PAC members work with other advocacy groups in their region. So whenever we send out our application to families, at the back is our Parent Advisory Council, our sheet, and kind of ask questions, of course, demographics, but then it asks, if there's any support groups that you're in, or if you are interested in support groups, if you're interested in certain sharing, and of course getting the newsletter to where you can see if the state has updated new policies, laws, bills, everything regarding any disability. And Stacey, is there anything you want to add to that?
They also are needing parents of children with special health care needs to be representatives for the PAC. You're the parents with special health care needs would be the voice to help. And right now they're not, I think they met quarterly before, but right now due to COVID, they're meeting, virtually. But if you know of any parents, or if you are a parent that might be interested, please take our contact information down and we can get Rodney Farley to get in touch with you, because we do have they do have some vacancies, and we do need parents that are going to be advocates and to try to help. They do like a family bistro every year that tries to get some great information. We just had a family bistro recently where they had a lady from Social Security come and talk. They had some great information. They try to get some great information out there for our parents and be a support to our parents with children with special health care needs.
And then down at the bottom is our link to application contacts. It's a little more detailed instead of just the humanservices.arkansas.gov. And of course, this will be available for whenever it gets sent out after the presentation and everything. And then, of course, there is mine and Stacey's, her email address, and then, of course, my office phone and her state cell. So
her email address is the same as mine.
Yeah.
It's just hannah.rains. I just didn't think I had enough room. But this link is it has excellent information. It has our application. It has transition tip guides. It has a wealth of information that it would be very helpful for it doesn't have the transportation information on there, and it doesn't have the RHIP, but it has just about everything else on there. It has a wealth of information to help families with children with special health care needs. So do we have any questions or anything? And I will, like I said, I've got the transportation information, the RHIP. I have the new applications for the Arkansas Autism Partnership that I can send to people if they ask. I will make sure and get them to Katie and to Shelby. I do appreciate Katie reaching out to us and Shelby for giving us this opportunity. Part of our job is outreach. We welcome any questions, or if anybody wants to contact us, please know that we're here to help, and we want to help in any way that we can. If there's any questions, or y'all want to give us a call, or if you have a specific thing that you think that a family needs help with.
I just want to say thank you for the presentation. Stacy, every time I'm in the room with you, and I'm kind of in the room with you now, even though you're not in the closet with me right now, but every time I'm with you, I learn something new, and I really, really value that. I think that what you girls have to share with us and with all of our folks here that are watching this webinar is so very important. And if you're educating us and we're pushing that out there to our families, and then it's working. I think it's working. So
well, we're striving and we're trying to get more information. I just want to tell you this real quick. Charlotte and I think Charlotte was on here. Charlotte and I she had an issue where a child was trying to go to school virtually, and their hotspot wasn't working. They live in a rural area. So, and they were afraid they were going to have to go to court because they were going to be counted absent. So I just got on the phone, called the school.
mm-hmm.
And I didn't know I was going to get to talk to the assistant superintendent. And and he told me that, and this is what's great about it is getting in there and working and finding this information out. So he told me that there's a thing called Engage Arkansas. Have you heard of this?
Mm-hmm.
See, I haven't, and I
haven't heard of it.
But he says he's hoping with that they're going to help fill in some of these gaps. But he said, I'll assure you, if they're making some kind of effort to try to get, some of these people are not even turning any work in or doing nothing. He goes, if they even want to drive in the parking lot at night and they can get our Wi-Fi,
that's right.
Whatever.
That's
but
right.
I had not heard of this, and I know I'm not in the loop probably as much as you are on the education spectrum of it, Shelby, but I said, I'm going to do some research on that. But every day when I'm trying to help a parent, it seems like, just like the transportation thing, I was at a youth move conference, and that's how I heard about the parents being reimbursed at 52 cents a mile.
Mm-hmm.
And that you dig in there, and that's how you learn. And
Right.
I think that we can never learn enough.
Oh, I
we
agree.
Share it,
I agree. And that's why it's so important that we continue this kind of conversation and keep these lines open and share the information that we have. I learned today that not just one parent or a parent's air travel could be reimbursed. I didn't know that. So I've got all kinds of crazy notes here.
Did you know about the Frail Medicaid?
Right. I've got all kinds of crazy notes. So now those of you that participated, Katie's going to send you an evaluation of today's presentation. So be sure and fill that out and send that back to her. I'm sure she'll do it electronically, but we want your input because we need to know what works for you as an audience. We need to know what you want from us and what you need to hear more about. So again, thank you, Stacy, and thank you, Hannah, for you girls for joining us today and helping us out here with this terrific presentation.
I got a little emotional too about that one thing, but it was just very touching.
I'm telling you, Jeremiah Knight only went to Camp Aldersgate 1 year because he wouldn't go prior to age 14. But when we finally got him there, it was an amazing experience. And I could talk about that in a webinar all of my own. It is wonderful, and it is very emotional, certainly is. So thank you, ladies. We really appreciate you joining us today. And thanks to our audience too for joining us. We appreciate that very much. And if we can help at all, y'all be sure and shout out to us.
Thank you for the opportunity.
Thank you.
Bye.
Bye.
at the bottom right.
Yeah, I was just seeing the chats. Thank you. Hey, Katie.
We've still got, I think, 7 here. I made you the host, so until you hit leave, it'll still keep on going, but it's
Okay,
not recording.
If you don't mind, if you can just give me a list because we need that for our block grant.
Yeah. Of course.
Thank you. Thanks so
No.
much. Okay.
Thank you. We appreciate it.
Bye-bye.
Bye.